we commissioned California's first ever State of the Asian American, Hawaiian, Native Hawaiian, and Pacific Islander Health in California. The first time ever. We asked them to do something very simple. Come together, our best research communities in California, and give us a report on our communities. And I was shocked again. Much of the research lumps all 40 of our communities together. And the research, when you lump it together, implied that we're a model minority with very few health and mental health issues. It's kind of like doing a study of breast cancer in California or the United States, in which we take men and women, the data on breast cancer, and we lump them together and we say, boy, as a state and as a nation, we're doing pretty well on breast cancer rates. But when you disaggregate or when you separate the data, you say, holy mackerels, women are dying and at risk at alarming rates because we've lumped them together with men who have very low rates and concluded that there is no problem here. And so what little data there was focused on 2 or 3 of our communities. But being from Hawaii and growing up with Native Hawaiians, Somoans, Tongons, Fijians, and Chamorros and others, I couldn't help but notice that almost no research had been done on them. And out of all the research on cancer, obesity, hypertension, on all of these ills having to do with physical health, the most glaring lack of data was on mental health. And I want to tell you, there are over 40 Asian American, Native Hawaiian, and Pacific Islander groups in California. And even though we all look alike to the mainstream, we're all very different. And that's why today you're going to find out how some of us are called victims of war. We're more at risk for post-traumatic stress. Others have problem gambling. And others have lack of health insurance. But we all have language need issues, and we all lack resources. And so I just also want to tell you this is personal to me because my brother-in-law was diagnosed with schizophrenia and paranoia. But I never knew that until he passed away. I never knew it because every Thanksgiving and every Christmas and every New Year's, he was always missing. And when I asked my sister where was he, I was told he was sick, he was on vacation, he was off on another island. And I never knew until he passed away that after he'd got admitted to a very prestigious college, they found him one day standing on the top of the cafeteria about to jump to his death and then shuddering him up because we were so shamed. And they were so shamed to tell me about it. So, what's the primary purpose of this? I'm going to just give you a little limerick. The primary purpose is to educate, to get irate so you can advocate and emancipate and liberate. And don't be late. Don't dwell on self-hate. Don't procrastinate because our people can't wait. Prevention can't wait. Treatment can't wait. More resources can't wait. Aren't you glad you made it to this date?